It's Mystic from Mystic Moments. Today we're going to talk about, as a nurse, do you know and understand your patient with congestive heart failure? Not the patient who just happens to have congestive heart failure and came to see you in whatever capacity you're serving in today, but the one that's there because they have problems with congestive heart failure. And why that's important. And what are some simple things you can do? Let's say 5 things you can do as their nurse to help them leave empowered with better knowledge and a better chance to live a vibrant and healthy life. Now I know, you're going to say, Mystic, it's a chronic disease, they'll never get rid of it, they're not going to have a vibrant life. Okay, but if they've been living with congestive heart failure and the slow, subtle signs of it, what if you're the thing that they remember and your words are the ones that they take back home with them and that helps them have 2 or 3 great days, which inspires them to have a great month or a great week? You've made a difference, and that's what we go to the bedside to do every day. So, congestive heart failure, here we go. It's a pump. Your heart's a pump. The easiest way to remember right-sided versus left-sided, there isn't one. Sorry. No cheat there. But you can understand the heart. And you can understand that when blood goes into the right side of the heart, it leaves the right side of the heart to circulate through your lungs. So right-sided heart failure generally has respiratory symptoms, shortness of breath, pulmonary edema, all of the things that put more water in your lungs than air and cause you not to be able to breathe, and especially not to be able to have a decent oxygen saturation level. The other thing you can remember about heart failure to differentiate right from left is the left side of your heart is what pushes blood out to all the nooks and crannies of the body and brings it back to be recirculated into the lungs and be oxygenated and then pushed back out. So that's the wishy-washy part of your heart. So if you have left-sided failure, you're going to have things like dependent edema. If they sit at a desk and their feet have been down all day, their feet are going to be swollen up because gravity works always. If they say, my shoes are too tight, or I can't lay down at night and sleep, well, that's because they've got dependent edema, and the lung, when they get flat, their lungs, when they get flat, are filling up with fluid because everything that's been in their feet all day is rushing to their core. So there are some things we can do about that too, and some questions we can ask. Have they been taking their medicine? Are they on a diuretic? How many of them are going to tell you, well, it makes me go to the bathroom, and when I have to be in town, or I have to be in work, or I've got to travel, I don't take my medicine right. Okay, well, life happens, and that's understandable, but you can talk to your patients about how to better align their schedule with the things they need to do in life and still get their medicine and still live life. That's why we're here, is to navigate those gray areas with them so they have a better life. So ask the questions. Make them tell you what they ate for lunch the day before or the day before that. When they tell you they've had 2 barrels of boiled peanuts or a bunch of crawfish or sodium out the wazoo, because they don't understand that salt is salt, whether it comes in a can or out of the shaker, then you have the opportunity to share with them and tell them what they can do better and the better choices they can make to live a more symptom-free life every day that lets them enjoy life and enjoy their families and enjoy the things that make them happy while they have time on this earth. So that is our charge at the bedside. The other big opportunity you have is in congestive heart failure. One of the best ways we know now that we can get patients out of an exacerbation and back towards baseline is BiPAP. We use the pressure in the BiPAP mask that we strap to their face to push that water out of their lungs. So if we know that going in, we can prepare the patient, because how many anxious Hypoxic congestive heart failure patients have you taken care of that are just restless and that can't be still in the bed. That's because their oxygen levels are going down and they are essentially drowning in their own fluid and they get scared. So talk to them about what's causing their anxiety, what you can do to help it, and if they can just manage to stay still long enough to let that pressure work and let those tools work, then the fluid will get pushed out of their lungs, and that you're right there with them to teach them how to prevent one of these episodes in the future. Now, congestive heart failure is chronic. There is no getting rid of it. There is no cure. So what we do know now is that the more we teach patients about how their everyday decisions affect how they feel, will directly impact how many times they arrive at our healthcare system for us to address problems where they may have quickly regressed in their disease, or quickly progressed in their disease process, or regressed in their recovery. So we need to be very diligent in the questions we ask, make them personal, make them real for your patients, and understand the disease process before you get to the bedside so that you understand in your plan of care in whatever setting you're in what your role is to help that patient help themselves. And as always, serve around common sense, do no harm, and take no shit. Have a great day, y'all.